Very interesting talk to follow. Thank you for that. Had a wonderful experience with bitters. I was fortunate enough to, in my travels across Europe a number of years ago, spend a month in Florence, Italy. And my friend who was hosting me explained that the shop where we had gotten our coffee and biscotti in the morning was open again after the break that they take, where everybody goes away for a few hours in the middle of the day and then opens up again, but that there was a separate entrance, but it was the same shop, so I was intrigued. So we went back to the shop and we went in through the separate entrance, and there was this kind of grimy looking bar with suspiciously dirty looking glasses, what I understood that everyone had been given what they were given, and then they would rinse them and wipe them and put them back on the counter. So kind of a communal exposure. But I said, what's going on here? He said, well, the shopkeeper specializes in dispensing bitters. And I said, what do you mean? So she started speaking with him in Italian. He would speak with her in Italian. She would ask me, what kind of day have you had? What did you have for lunch? How are you feeling from the lunch? Are you looking forward to dinner? Do you feel hot? Do you feel cold? Are you going to see a show this evening? Are you enjoying your time in Florence? Blah, 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 blah. I mean, it was, 2 or 3 minutes of active conversation about where I was at, what was in my stomach, did I have any physical problems, did I need to pee, what was going on for me. And while the guy's getting the answers, he's reaching up and taking bottles and pouring a little splash in the glass, a little splash in the glass. And I got about 4 or 5 things mixed at the same time, puts it on the counter, and looks at me, and she says, he wants you to drink it. So I drank it, and I did this every day, and it was remarkable, because every day there was a different song that was played on the pipe organ, a different combination of bitters that was given to me based on the answers that I gave to him. And I think about that often when I'm putting tinctures together in my pharmacy, when I'm mixing up a bottle for a patient for whatever complaints they might have, and remembering that process and also thinking through the information that the patient has given me. And in terms of labeling, absolutely right information. You want to tell them what it's for, you don't want to burden them with the ingredients. I keep a minimum of chart notes, and I'll have labels on the drops that say stuff like, good Lord, take me downtown, okay, in quotes. And it's like, what do you mean? Am I supposed to remember the Allman Brothers? Does it taste like cocaine? What am I thinking here? No, it's like, give me some peace, give me some relaxation, give me something to look forward to, get me out of my funk. Okay, fine. Or for the woman that I helped with the fear of flying, when I spiked her with some lactuca and a little bit of datura for flavor. Yup, yup, and away drops. Just something to get out of the headspace there. So going along with more information about the personalized relationship between the practitioner and the patient, that I was really glad to see a lot of references that Dr. Nagel brought by in his speech, coming from the eclectics, about things that I'd been doing that I might have read, but I've quite frankly forgotten. And it's so nice to see that there's someone who I hold in such high regard who was advocating doing what I'm doing with my patients, because I've seen that it works. So the idea is to try, again, as Dr. Nagel was talking, learn how to help the patient to dance with their particular situation going on in the here and now, to identify not necessarily why they feel so bad, or why life is terrible, or why their spouse left them, or why their dog died. Okay, all of that's fine, but where does the trail of breadcrumbs start? What can we do today? How can we begin to incrementally start the process? Because always these healing journeys begin with very, very small incremental steps. And if you can get them to the point where they actually believe that they can be their own masters, they can move their own fate in the right direction, they can take control of their own destiny in a world that may seem to be horribly cruel or insensitive or not make very much sense to them, then you're giving them a great gift. I was thinking about a conversation that I had earlier with a colleague about where do you draw the line between empowering a person and being drawn in too deeply. So using the pharmacy that I get primarily from this company, allowing the person to begin to take those small incremental steps, but always holding yourself somewhat apart, somewhat aside, insisting that they take responsibility for their own health, that they do the right thing for themselves, that if they ask you, what can you do for me, and you say nothing, that they're not disappointed. And you come back and you say, but you can do everything for yourself. I can hold up the lantern so that you can see your path a little more clearly, but I can't walk those footsteps that you need to take in order to do your journey. That's up to you. And the temptation to become involved in that is very seductive. To be that intercedent, like the story that I told you about the nun who told me that she was being raped by Satan, and that Father thought that I could exorcise him from her, and it was like, I got a sense of humor, but come on. Standing up on the rooftop, giving the finger to the heavens in the middle of a lightning storm while holding on to a lightning rod is not a good way to position yourself. So understanding that there are people that are going to be sufficiently dysfunctional that they are going to want to unburden themselves and to lay themselves off on you so that you need to experience their process for them. Not that you can't be somewhat of an old-fashioned sin eater, but I think that expression has become misunderstood. It's not that you're taking on their sin and eating it for them, but that you are eating sin, experiencing the process of dealing with that and getting rid of it so that you can be a better guide. So you're not actually eating their sin, but you're acquiring that information and that knowledge. And how do we convince and we mentor the students that are in the naturopathic schools now that they need to have this sort of welcoming perspective with the medications that they use, with the therapies that they're attempting to use in conjunction with treating patients, that they need to pay a great deal of attention to their mentors in school, and to be accepting of the fact that what we're called upon to be are the consummate generalists, that we have to embrace any and all healing strategies to become as expert in them as we possibly can, so that we can find out which one resonates with them, which one fits for them, which is the best solution. To understand that trying to jump into a specialty early to become only interested in homeopathy. Why do I need to learn about pathology when I'm going to be a homeopath? Why do I learn to know about botanical medicine when I'm going to only be an acupuncturist? And I don't think you can be a good naturopathic physician if you wall yourself off like that. You can develop areas of special interest, but I truly believe that we need to have our shops open to whatever walks through the door. Anyone in any form of complaint. I'd say it's the reason that I stay in practice, the reason that I'm doing what I'm doing, the reason that I like to intentionally book holes in my schedule so someone can call up and come in and surprise me with some sort of craziness going on, and that's what keeps it very rich and very real for me. And I think that by working on and perfecting this sort of information resource that we're trying to develop here today, not only with a diversity of opinion, but with people who have spent time in the saddle, who know the realities of naturopathic practice, and granted how much we rely on providers like Eclectic Institute to give us the consistency and the quality of medication that we need to prescribe, that we can do it efficiently. Prescribe. What I tell patients is, no, I can't suggest anything to you. I can't recommend anything to you. If you see me in a health food store, I might recommend something to you. If I was walking down the street and I didn't know you from Adam, and you said, I've got a scratch, what do I do about it? I might suggest something to you, but if you're in my office and you are expecting me to perform and to behave as a physician, I'm going to prescribe. Why? Because that means you have the right to expect that I'm doing that with an understanding, as much as I can glean, of what's going on with you, that I'm empathizing with you, and that I am taking responsibility for what you're doing. If I tell you take 6 glasses of water a day, that's a prescription, and you can write that off as unrecovered medical at the end of the year, because I prescribed it. Doesn't matter if it's OTC, it's a prescription. And we have to encourage our students to understand how the media may be manipulating things to trivialize those things that are non-legend, to make believe that the uninitiated can come up with various dietary and lifestyle manipulations that are going to make really good sense, that are going to affect people's lives, that are going to help them lose weight, like Marie Osmond or something like that. But I was telling a story earlier about how I got involved with my first job with the late and often lamented Robert Atkins, who confessed to me that the diet that he was using was taken from another New York practitioner named Arthur Stillman, and the idea of a zero carbohydrate, high fat, high protein diet was originally developed at the turn of the last century by a British undertaker. And then I said, so what do you want with me? And he mentioned a couple of my professors at NCNM, and he said, you know these guys? I said, yeah. He said, well, they're great ghostwriters. I said, okay. So what's going on with the patients? He said, I spend 8 to 10 minutes with a patient, and then I move to the next patient. I would hire someone like you to work in my office to do the complete histories and physicals of all the new patients coming in, and see the return patients while I see the new ones, because that's where I make my money. I said, okay, what's the average life of a patient at the center? He said, about 3 weeks. They lose weight initially, then the weight loss stops, they become dissuaded, and they move on. I said, is that a good thing? He said, yeah, it's good for me. It's about $5 or $6 grand a pop. And so I went from the clinic on Market Street here in the wonderful rural environment in Portland to a downtown office in Manhattan overlooking a tennis court, just working like a crazy man, seeing all these patients back to back to back to back to back. And then I asked him, I said, you know, I'm not licensable in New York. He said, it doesn't matter. I said, why? He said, I'm the deep pocket. They're not even going to look at you. There's a problem. I said, what do you want me to do? He said, well, don't do any major surgery, and if someone's going to drop dead, make sure they drop dead on the other side of the threshold. So I said, well, what about doing really cool things? He said, like what? I said, well, I'd like to potentize some IV drips with some Requig homeopathics and, try some interesting intramuscular mineral and vitamin injections. He said, go for it. And so I did that to beat the band in New York. When I went out to Connecticut, I found out that the Department of Health out there was not so enamored of naturopathic physicians potentizing drips, doing things like that. They had an allergy to us doing that sort of work. So I had to cease and desist. But the issue with that was that I went into that to see what conventional medicine could be like, and it further encouraged me not to do that with patients, not to allow that sort of superficial relationship, not to participate in that, because not only was it not helpful to the patient, but also it was personally destructive. I felt that the gastritis that I was developing from working with Atkins was in the process of turning into a duodenal ulcer, and I had to get out of there, otherwise I was really going to injure myself. And so I went out to Connecticut and stayed there. But what I'm trying to emphasize today and in this talk and in the YouTube segment that'll hopefully come from this, and the further talks that will be given not only in Cincinnati but also at the naturopathic medical colleges, is to encourage young rising NDs to embrace the art as well as the science of naturopathic medicine, to rely on companies that are ethically committed to consistent excellence in what they're doing, like Eclectic. And if I didn't believe that, I wouldn't be here. I really do. And again, it's not just based on my ongoing impression of who Ed Allstat was and is, but also how the company manifests with consistency and excellence. And I really do believe that. But I think that also it's important to understand the relationship of what it is that we do within the continuum of medical care delivery in this day and age. In that naturopathic physicians provide health care and MDs provide disease management, there's certainly a place for them in the continuum of care, but we have it a little bit backwards. We shouldn't be getting the patients who are MD failures. We shouldn't be getting the poor lost souls who've given up on everything else and who are looking to us where quote-unquote modern medicine has failed. That's why I call my practice Southbury Clinic for Traditional Medicines, because what we do is traditional. They're the new kids on the block. Just because they succeeded in making medicine a mercantile business doesn't necessarily mean that it's the best way to do things. But as I said, I think that there's a place for them in the continuum, but they need to be working for us. We need to see the patients first. We need to get them healthy as much as we can. And if we need pharmacological suppression and that level of expertise lies outside of what it is that we're doing, we can refer to an MD as a specialist for a consult and work with them so that we can minimize the side effects of the drug and get them off as quickly as possible. They do need ablative surgery. They need some other kind of invasive procedure. We can better prepare them for it. We can help them to present at surgery, to succeed more quickly, to recover from the anesthesia more quickly, to encourage, as I mentioned before in my last talk, to improve first intention healing so that the MD looks better. Okay. Oh, Dr. So-and-so, you have such a great reputation, your surgical skills, blah, 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 blah. Look, I don't have a scar. Yeah, it's because of the collaborative venture. I'm trying to do that without giving away the store. Over the 30 years plus of practice, I've had MDs who've come in who've shadowed me, have interned with me, and quite frankly, most of them have gone off and tried to set up their own little green MD practices and make believe that they're doing what I'm doing. But I've gotten a little wiser in doing that, and I'm working with a couple now that I'm very optimistic about. And I will follow up with the group on the success of that and let you know how that's going. One effort that I'm hoping that will work out very well is with a medical doctor who's very spiritual. He has been the personal physician of a character down in Brazil named John of God, and he's a urologist. And we started co-managing patients together a number of years ago. And he is moving forward with the idea of putting together a collaborative practice in Manhattan where we're going to be providing information for people with prostate and breast cancer so that they can be better stewards of their own health care. And it's going to be posed as an informational effort so that we don't have to worry about practicing, quote unquote, without a license. So we won't be practicing. But that's what I'm trying to do with the continuum of care, to try to provide for patients and to try to make some kind of peace with the medical doctors and not just think of them as being opportunists. And maybe, continue to believe that they actually want to try to help people and that they're not just there to make money. And I'll conclude and let Francis speak. Nice talking with you. Thank you very much.